So, Dr. Katz, thank you again for joining us. We did, as Ed said, wanted to take on the topic of mRNA, which is the messenger RNA vaccines that have been given emergency use authorization. So we have a couple questions we'll pose to you and let you discuss those. So can you simply explain to us what is mRNA when it comes to the vaccines?
Well, mRNA stands for messenger RNA. This is, in the case of these vaccines, a segment of the genetic material of the virus that is used to tell a vaccine recipient's immune cells, white blood cells, to make the spike protein from the virus that provokes a very strong protective immune response without the need to use a live virus, an attenuated virus, a killed virus, or a protein from the virus to do that. For technical reasons, it allows very, very rapid development and modification of the vaccine. During a natural infection, the virus would do this, make the protein, but it would also instruct the infected cells to make many other proteins that eventually assemble into more viruses and cause disease. So with the messenger RNA signal, all we get is that one protein that we want to use to provoke immunity. It's contained inside a fat particle that is taken up by the vaccinee's cells in the lymph nodes where a shot is given, where it promotes production of that protein. The messenger RNA is gone within less than 2 days, and the protein that is made teaches immune cells to make antibodies and other parts of the immune response.
So we've been hearing about these mRNA vaccines as new, but is mRNA itself a new thing?
Well, it's evolutionarily conserved for literally hundreds of millions of years. These vaccines are the first messenger RNA vaccines to be used in large numbers of vaccinees, but vaccines for influenza, Zika, rabies, and CMV, cytomegalovirus, have been under development and studied for a number of years in both animals and small human studies. So they're new to the public. They're not new to the scientific and medical community.